Hi everyone, welcome back to my channel. Today we will study anatomy of ovaries with its functional overview. We will cover the following objectives: its introduction, location, size and shape, spotting ligaments, structure, stages of follicle development in relation to menstrual cycle of 28 days inside the ovary, functions and blood supply. Let's start it. Ovaries are paired, oval shaped female reproductive glands that are responsible for development and release of egg, that is also known as ova, and secretion of hormones, which includes estrogen and progesterone. Ovaries are located on the either side of the uterus in the ovarian fossa on the lateral wall of the pelvis. They are almond oval shaped glands. They are about 2.5 to 3.5 centimeter long, 2 centimeter wide and 1 centimeter thick. Ovaries are supported and held in place by various three ligaments in the pelvic cavity, which includes ovarian ligament that attach the ovaries to the either side of the uterus, suspensory ligament that anchors the ovaries on the lateral wall of the pelvis, broad ligament that is the fold of the peritoneum, and it also supports the ovaries in the pelvic cavity. Structure of ovaries. Ovaries has two layers of tissues: medulla that lies in the center of the ovaries and contain fibrous tissue, blood vessels and nerves. The layer of tissue that surrounds the medulla is the cortex. It has the framework of connective tissue or stroma covered by germinal epithelium. Cortex contains ovarian follicles at various stages of its development during menstrual cycle. Let's discuss the stages of ovarian follicle development during the menstrual cycle of 28 days. At the beginning of the cycle, by around day 1, there are immature follicles known as primordial follicles present in the ovary. As the cycle progresses, some follicles start growing under the influence of follicle stimulating hormone that is secreted by anterior pituitary gland, but only one follicle become dominant. By around day 12, one follicle becomes mature and known as mature or ovarian follicle, which contains ovum and liquid folliculi. By around day 14, this mature follicle ruptures and releases ovum, that is egg. The process known as ovulation. So ovulation occurs at day 14 of menstrual cycle. By around day 20, this follicle, after releasing the egg, converts into the structure known as corpus luteum. Corpus luteum secretes hormone that is progesterone, which prepare the uterus for possible pregnancy. If fertilization does not occur, then this corpus luteum degenerates and convert into the fibrous structure known as corpus albicans by around day 28. This is mesovarium. Blood vessels, nerves enters through this mesovarium inside the ovary. Follicles are classified according to its stages of development inside the ovaries as primordial, primary, secondary and Graafian follicles. Functions of ovaries. Oogenesis. Oogenesis is the production and development of female gametes that are eggs or ova. Ovulation. Ovulation is the release of the mature egg from the ovaries at day 14 of each menstrual cycle. Endocrine function. Ovaries play important endocrine function by secreting important sexual hormones, which are estrogen, progesterone, and inhibin. Estrogen, that is released from the developing follicle, is the important sexual hormone. It is important for the development of secondary female characteristics, which includes menarche, that is the onset of menstruation, breast development, auxiliary and pubic hair growth, and increase in height. Progesterone, that is secreted by corpus luteum, prepare the uterus for the possible pregnancy. Blood supply. Arterial supply is by ovarian artery that branch from the abdominal aorta just below the renal artery. Venous drainage is by plexus of vein from which the ovarian vein arise. Right ovarian vein drain into the inferior vena cava and left ovarian vein drain into the left renal vein. In upcoming lecture, we will discuss menstrual cycle in detail. If you found my video helpful, then kindly subscribe, like and share my channel. Thank you for watching.